Okay, everybody, welcome to the American Heart Association Montgomery County CPR demonstration today. We are really grateful that you're here with us. This will be recorded and we will also distribute this information out far and wide so everybody can have this really important information. I did want to start us off by thanking our sponsors. Thank you so much to the Montgomery County Heart of Montgomery County sponsors on the screen right here. I'm not going to go over all of them due to time because we have a really great and important demonstration and I want to make sure there's enough time for questions at the end. But thank you all for being a part of this and for helping make this happen. We have guest speakers today. Brian Perry is a first responder coordinator for Montgomery County Hospital District. And then our CPR ambassador is Ron Mullins. And I'm going to turn it over to Brian to introduce Ron.
Hello, everybody. First off, I'm pleased to be hosting the fourth and final happy half hours in support of the Heart of Montgomery County campaign. Like Tracy said, my name is Brian Perry. I am the first responder coordinator for Montgomery County Hospital District. And as the host, I get the unique opportunity to commend a group of people that usually don't get to be commended all that much. In the news recently, we had the governor sign into law a new bill that is going to require all telecommunication centers that handle the 911 EMS calls to be able to provide telephonic CPR or CPR instructions over the 911 phone. Luckily, in Montgomery County, we've been doing this. I talked to Chief Cotter, who's in charge of the dispatch center for Montgomery County, and we've been doing some sort of telephonic CPR since 1993. And then we've been accredited since 2007. Our dispatch center has been also responsible for helping out 30 other agencies and taking 911 medical calls for them over the past few years. This year alone, our dispatchers have been able to provide CPR instructions 316 times over the phone. So that's just from January. And based off of the American Heart Association's Center of High Performance, they like our dispatchers to recognize it in less than 60 seconds. And on average, our dispatchers are recognizing it in 30 seconds. And they're giving hands-on chest in less than a minute and 20 seconds. And on average, our dispatchers are right at 67 seconds. So they're doing an awesome job helping that crucial link of survival. And they're playing a great role and they're doing a good job in Montgomery County. I've invited Ron Mullins to help share more about CPR and his work in the community. He's been involved in raising awareness for CPR when he lost 2 of his friends in 2 years, both with having someone next to him when they collapsed. They just didn't know what to do. Working with the AHA, he put together a group of people to be CPR ambassadors in the community. In the past 4.5 years, he and his team have conducted educational presentations, demonstrations at over 160 events and taught about 3,000 people. So welcome, Ron.
Thank you. Thanks, Brian. I appreciate it. Thanks, Tracy. Thanks for hosting this thing for us. This is good. The interesting thing about CPR and Brian, to put a pin on the head of this thing, when you call 911 and the operator starts showing talking about how to do CPR, people don't need to be afraid that they're not getting response. The response has already been sent. It's been sent already, and they're just trying to help you understand what's necessary to save a life. We recently had a very prominent situation. It was in Europe. Christian Eriksen, a very renowned, popular soccer player, had a cardiac arrest on the field. He was, the professionals around him said he was gone. And yet, because somebody knew CPR and was able to present CPR, administer CPR, his life was saved. What's important is that he was gone, but he wasn't. And the reason that he wasn't is because somebody knew enough to do CPR and save his life. We're not going to get into the broad stuff today, but I am going to talk about some basics. And the basics that we need to understand is that CPR will save a life. And the reason it saves a life is that we are compressing the heart and pushing blood into the brain. We're keeping the brain alive. Now, I'm going to answer two questions right off the bat that everybody's going to be asking. First and foremost, do you still have to do breaths? And no, you don't. The protocol changed in 2008. We're only doing bystander, hands-only CPR, so you no longer have to do breaths. Everybody's concerned about that with respect to the pandemic, but we don't have to do breaths on an adult to do CPR. We're just doing chest compressions. And the other question that I'm always asked when I do a presentation is, I hear I could break some bones. And yes, you probably will. If you're doing it right, you're going to crack some bones in the chest area right here, because you need to make sure that you're compressing that heart. If you look at the image on the screen, on the compression side, you see where we're compressing that heart. The rib cage is being compressed down onto the heart, and we're compressing a chamber in the heart to push blood out of the heart and into the system. So we are probably, very likely, going to break bones. But the person that you're doing CPR, the person on which you're doing CPR, is going to be appreciative of the fact that they're alive, even though they do have broken bones. So don't worry about the broken bones. Just do the compressions and make sure we get good blood into the brain. Having said that, one of the most important aspects is the time frame for which we have to work. When Christian Eriksen had his cardiac arrest, they were doing CPR within 60 seconds of his collapse. The American Heart Association has, through its research, determined that we have between 10 and 15 minutes in order to get blood flow, oxygenated blood flow into the brain to keep the brain alive. If we can't meet that criteria, then we're not going to keep the brain alive. And if we don't have a live brain, we don't have a friend, loved one, coworker with us any longer. We don't want that to happen. We want to make sure that we're getting oxygenated blood into the brain to keep the brain alive, to keep that person with us. Now, today's steps in CPR, if you've had a CPR class before, you know there's probably in the earlier classes, there's a multitude of steps. Today, we only do 2 steps. We do 2 steps, and the first step is call 911. We're going to follow up with what Brian told us earlier. Call 911. The 911 operator is going to ask where we are, ask the situation, and then get CPR started immediately. When we get that done, put the phone on speaker, set it aside, and then what we're going to do is we're going to be doing compressions, chest compressions to keep the blood flow. If you'll look at that image up on the right-hand side of your screen, we're taking both of our hands, and we're going to take the pad of the palm of our hand and place it right in the center of the chest, that valley of the chest. Curl the fingers, and then take the other hand and wrap it around those fingers. We want to make sure that we have, see how the angle of the hands are on that compression drawing? The hand is up so that we're pushing all of our weight, all of our thrust is going through this pad of the palm of our hand, down the arm, through the pad of the palm of the hand, and into the valley of the chest. Now let's take a look at the other image in the middle with the young lady doing compressions on the person on the floor. We're going to be on our knees. Our shoulder is going to be over the top of the patient, the victim, and we're going to be using the weight of the upper part of our body and driving down to do the compressions. We're not doing arm pushes. we're using the upper part of our body as weight to compress down on the chest. Elbows will be locked, shoulders will be locked, and we're rocking with our thighs and our upper body to drive pressure onto the chest to compress that heart. And what we're doing, if you look at that image on the left-hand side, we're pushing the heart to get blood into the brain. This is not to scale, but it is representative of how the blood flows out of the body. There's actually two main arteries that come out of the heart that go into the brain, two arteries that come out of the heart that go into the rest of the body. Now, if half the blood supply coming out of the heart is going to the brain and half the blood supply is going to the rest of the body, that should tell you that the brain is awfully important. We want to make sure that we're compressing that heart, getting oxygenated blood flowing to the brain. We really don't care that much about anything else. We want to keep that brain alive. And this is how we're going to process that CPR compression. Compressions are going to be continuous. Once we start the compressions, they're continuous. We're not going to stop for breaths. We don't have to stop for breaths. We're just going to continuously compress the chest to keep that blood flowing into the brain. And it's going to be at a pace of about 100 to 120 compressions per minute. And the ideal song, if we want to add a song to help us with that pacing, for those of us that are of a particular age, we're familiar with a group called the Bee Gees, and they had a song called Staying Alive. It's a nice song in that it's giving us a mental visual to stay alive, but it's also giving us a beat so that we can keep that compression going at 100 to 120 beats a minute. Actually, there's a University of Pennsylvania did a study and found there's about 24 other songs that have that similar beat. And for those of you that are of a younger generation, interestingly enough, Bruno Mars' Uptown Funk has that beat. So let's at least sing something along to keep the beat going and keep the heart pumping and keep that blood flowing into the brain. So, do we have any questions so far on the process, the administration of CPR? If we do, just open up a chat and let us know.
I do have one question.
Yes, Tracy.
So because of the concern of breaking the sternum, you can keep going, right? If that happens, you keep moving. You don't pause, correct?
That is correct. Now,
Okay.
we don't want to break the sternum in the xiphoid process. The sternum is at the very bottom of the breastplate. We want to be about 1 inch to 1.5 inches. Our hand should be 1 inch to 1.5 inches above that sternum so that we don't have the risk of breaking the sternum. If you think about it, your hand is going to be center of the chest, in the valley of the chest, right at the underarm. So right as if you look at the underarm and you bring your hand from the underarm to the center of the chest, it'll be right there, about 1.5 inches, 1 inch to 1.5 inches above the sternum for compressions. Something that we want to take into consideration. I'm not a large guy, but I'm an average guy. If I'm going to be doing CPR on somebody that's smaller than I am, I want to take into consideration that my weight factor may have an adverse effect on the compressions. I will be excited. The adrenaline will be pumping. I'm going to be doing everything I can to try and get blood flowing. I might be a little overzealous if I'm doing compressions on somebody that has a smaller frame than I do. So I want to be conscious of that when I'm doing CPR on someone with a smaller frame. Ladies, if you're of a smaller frame and you're doing CPR on someone that's of the similar frame, don't worry about what I just said. Just do both hands and do the compressions. But if you're larger, guys, if you're larger than the person that you're doing CPR on, then you want to be conscious of that. And if their size is significantly smaller than yours, whether it's an adolescent or a petite woman or the like, we want to possibly put one hand behind our back and just do the compressions with our dominant hand. That way we're conscious of that compression weight and we're not going to make things worse than what they could be. If there's no more questions, I think the next slide has some significant information that everybody should know. Interestingly enough, Hollywood presents a singular focus on the heart attack symptom. Hollywood promotes that we'll feel this elephant on our chest and the left arm goes numb. Well, that's great for us guys. That's the typical symptom for a man. However, ladies, and this is specifically for you, the physiology of a woman is different than the physiology of a man. We like that, but that causes some considerations. You will likely not have the same symptoms as I would have. Consider that if we're having sudden, intense dizziness, sudden, intense heartburn-like feeling, cold sweats, unusual tiredness, nausea or vomiting, we have the potential of that being the symptom of a cardiac arrest in a woman. I know of a woman that actually had those symptoms, recognized those symptoms when she was driving down the road in her truck. Fortunately, she recognized the symptoms and took action so that she saved her life. I also have a friend of mine. His wife was having those symptoms. Didn't sound like she was having a normal evening, so he called 911. Sure enough, he saved her life by recognizing those symptoms, and she's alive today because of that. I know Brian mentioned that I've lost a couple of friends because the person standing next to them didn't know CPR. Well, I have a friend still with us because her husband did know the symptoms and was able to administer CPR. So we want to be knowledgeable about what's out there. We want to be aware of the circumstances and symptoms. We want to be able to administer CPR so that we can keep friends, family, coworkers, and loved ones with us for a longer period of time. Don't want to lose any more friends. I don't want you to lose any more friends. I don't want you to lose any more coworkers. Any questions that we have at this point? And if you want, you can unmute and ask, or you can send it out on the chat, and we'll be glad to address any questions or concerns. I know we went over this a little fast, but I want to make sure we get the most important aspect of what CPR does and how it saves lives out to you so that you can learn and we can keep people alive. And if you're a soccer fan, you can keep more soccer players alive.
So I just had a question, which I know is kind of something that we all kind of think about is, a lot of the symptoms that women experience are symptoms we have on a daily basis. How do we know the difference, really?
If you're having these symptoms and you have a 2-year-old, it's probably the 2-year-old. But if it's extreme, if these symptoms are exceedingly extreme, they're intense, and there's really no other situation that's driving these symptoms, and you feel as if you have to tell somebody, make sure you tell somebody. Don't keep it to yourself. Don't keep quiet. Let somebody know that, hey, I feel nauseous. I'm having cold sweats. I've got a heartburn feeling. The back of my head is hurting, and I'm feeling like I'm about ready to fall over. Make sure you tell somebody so that someone else will be able to acknowledge, someone else will be able to pay attention, someone else will be able to manage the symptoms, call 911, be there with you, and help you address the circumstances. Anything further? Tracy, did I forget something?
I don't think so. This is great information. And you're right. Hollywood does make it sound like it's a one size fits all. And to know that there's such a difference between men and women is something that's really important to know. Very important to share.
I know Brian knows this, but if you've ever watched TV and you're familiar with the protocols of CPR, I've seen him do it incorrectly on Mission Impossible 3. I've seen him do it incorrectly on Chicago Fire. I've seen him do it incorrectly on Grey's Anatomy. I've seen them do CPR incorrectly on TV in medical facilities. I have seen a couple of places where they actually do it right. And I applaud those actors and the people that are promoting them to make sure that they're doing it correctly. Brian, you've seen that. You've seen it done incorrectly many times.
Yeah, it's the most frustrating thing sometimes too, because, you know, we spend so much time trying to educate the public and educate them on, you know, what to do. And then the popular TV show that millions of people watch, they go off and do it wrong.
Yes. Which is one of the reasons why, Tracy, I think having the remote training facility in places where we've got hundreds of people walking by would be an excellent exposure to the proper protocols and the ability to practice. Because if we don't practice how and what it'll feel like, how to do it and what it'll feel like, the first experience should not be the first time ever of doing CPR. Take a class.
Which has to lend to the hesitancy.
Attend something so that you can get your hands-on experience.
I agree. Any other questions or comments?
I'll just go a little step further than on what Ron said to Stephanie's question, as far as, you know, these are general symptoms. One thing that I tell a lot of my patients that when we go out there is, I'm not you. You know, I am not your body. You know you. If you feel like something is more off than should be, reach out and call for help. You know what you're feeling. You know what you've been doing versus how you should feel. So if something isn't adding up, always reach out and ask for some help.
Absolutely. It surprised me. I was talking to an OBGYN a number of years back, and it surprised me that she did not know these symptoms. She knows them now and she tells all of her patients now, but at the time she didn't. All right.
Anything else from anyone else? No more questions? All right, well then I'm going to turn it over to Brian to take us home.
Yeah, well, we're going to be going beyond the gala table with the heart of Montgomery County to address needs in our very own community. We hope that you'll consider making a meaningful gift today, or meet with Tracy in the AHA to learn how you can link arms with the AHA and fight against heart disease and stroke. If you want to donate, you can text Heart MoCo to 41444. That's Heart of MoCo to 41444. Thank you, Tracy, for bringing us all together to talk about this important issue. Thank you, Ron, for providing.
I think we lost you, Brian, but just to echo what he's saying, thank you so much, Ron, for being here and sharing all of your knowledge. Thank you, Brian, for being here and giving us a better, broader understanding of everything that we're doing in Montgomery County to save lives. And thank you all for your participation. We will record and share with as many people as possible to spread awareness and education of CPR. Let's all go out and save some lives. Thank you all for being here. Have a wonderful rest of your day and great weekend.